welcome to hello and welcome to another episode of You and Your Health. I'm Dr. Sandy Chapnick, and I hope everyone has had a wonderful 2009 so far. And if you watched my last show, I hope you all are now taking better care of yourselves so 2009 is healthier than any year you've had so far. This episode is going to be a little bit different. Most of what we talk about is how to heal the body on the inside. Well, we're bringing an outside force to today's show. And what we're going to talk about today is cosmetic laser. And I am fortunate enough to have met a fabulous, very talented woman. Her name is Toni Dardino, and she owns and operates Laser Enhanced Therapies in Tewksbury. And I want to read you a little bit about Toni so that you have an idea of what her qualifications are. She has owned and operated Laser Enhanced Therapies at 1830 Main Street, located in the Planet Fitness building for the past 4 years, and that's in Tewksbury. Yes. She's a 30-year alumni of the University of Massachusetts in Boston. And if you got a camera on her, you're going to see how good laser is, because you're not going to believe that she actually graduated college 30 years ago. She's a 30-year alumni of University of Massachusetts in Boston, where she received her Bachelor's of Science in Nursing. Toni is a certified medical laser safety officer with the Board of Laser Safety and is also a fellow with the American Society for Laser Medicine and Surgery. Welcome, Toni.
Thank you.
This is, like I just told the audience, this is a little bit different. This is being healthy on the outside.
That's right.
And when you are healthy on the outside, you probably also feel better about yourself on the inside.
I agree. I think that's why I went into this in the first place. I think how you feel on the inside is directly related to how you look on the outside.
Absolutely, and vice versa, right?
Absolutely.
So, I know I have a list of questions that I want to ask you, and just to shed some light on some laser. You're an RN.
Yes.
And you went into this. Was there a reason?
I was in a car accident, Dr. Sandy, and it was a chiropractor that actually got me back moving again. But I worked in ICU and couldn't lift the heavy patients anymore. Started working for a dermatologist, and he had lasers, and that's how I got trained. Okay.
And were there things that you saw in that office that made you want to make this your career?
It was just fantastic, the way you would see capillaries in someone's face just disappear after one treatment. And it just made the person look so much better. And I decided that I would pursue this full time.
So you really felt, and you are, really enhancing the quality of their lives?
Yeah, I think so. If they don't have to wear makeup to hide things on their face that they don't want to be seen, then they're more confident and they're happier.
I like that. So I do laser at my office. It's a healing laser. Your laser obviously is very different. How does your laser work?
It has a target. Lasers usually have a target, whether it be melanin or water or hemoglobin. It will heat up just that one target and leave everything else alone. And it will destroy a hair follicle if it's in the growth phase. It will vaporize a blood vessel, or it might stimulate collagen in the skin.
So when you're talking about hemoglobin, you're talking about those blood vessels that you're working on?
Yes.
And then the melanin are skin discolorations?
The hair follicle has melanin in it, so that would be the target for laser hair removal.
Okay. All right. So is that really what you mostly focus on, is more the hair follicle, the laser hair, and then the capillary type stuff? Yeah,
mostly. I'll do hair removal is my #1 treatment, and then skin tightening would be #2, and I'd say capillaries and leg veins would be #3. I do some sunspots as well, and that's usually just one treatment.
So skin tightening.
Yeah.
I like the way that sounds. So really what we're talking about is wrinkles.
Yes.
So you can really help get rid of wrinkles around the face.
Yes. It really does work. The younger you are, the better it works.
Because the wrinkles aren't as deep?
Well, I think we have some capacity to make more collagen the younger we are.
Okay.
It's not just there's more wrinkles or more tightening as you get older. I had a 32-year-old patient who lost 100 pounds and just had a lot of laxity in her face gone from the weight loss.
Right.
And after 3 treatments, it's usually 5 to 6 with
Okay.
my laser.
Okay.
After 3 treatments, it was completely enhanced, and she looked 10 years younger.
Wow. So really what the laser is doing is it's stimulating collagen growth?
Yes, it's stimulating your own body's ability to make collagen. It causes thermal injury, which produces the collagen with subsequent tightening.
That's pretty cool.
Yeah.
Now, laser. I'm sure people are kind of running through their mind, all right, is it safe? What do you think?
It's safe. Pregnant women can have laser treatments. It does not alter DNA
Okay.
the way X-rays do. My favorite toy when I was a little girl was my Easy Bake Oven. It's similar to a light bulb, a 100-watt light bulb in an Easy Bake Oven. You can burn yourself on it.
Right.
But it's safe.
Got it.
If it's applied at the right temperature to the right person, there's never a problem.
Do they feel anything?
You do feel it. It feels a little bit like a snap. It depends on how many or where the treatment is. Over the lip, there's more nerve endings, and it feels a little more uncomfortable there. Right on the cheek itself or the chin is very comfortable.
Okay. So is it just like a quick bolt of like a shot of laser?
Yes.
Type of thing?
Yes, and you're able to cover quite a bit. If you're doing laser hair removal, the spot size on the laser is about the size of a quarter.
Okay,
so you're able
it's a wide area.
Yes. So the top of the lip, you're done in 8 pulses from the machine. And it's really very easy to tolerate. And if you don't tolerate it, you can use a 5% MLOC cream that is applied a half an hour to an hour before the treatment.
So is that like a numbing cream?
Yes.
Okay. And as an RN, are you licensed to do that, or are you doing it under the auspices of somebody?
Yes, I have a medical director who's a plastic surgeon, Dr. Elliott Locke.
Okay.
He also does laser treatments in Southborough.
Okay.
And he's my resource person. If I have a question or a problem, I can call him up. And I can write a prescription for MLAR under him. So.
Wonderful. Yeah. So take us through a treatment. From start to finish. I assume you have to question them, or what do you do?
Do a Fitzpatrick skin typing.
Which is?
You need to know how they react to the sun, because they'll have a similar reaction to the laser. I have both wavelengths. I have a 1064 and a 755, which means if you have dark skin, for instance, the 755 would burn you. The
Really?
1064 goes deeper into the skin, so it bypasses the pigment color of the skin and looks inside to the pigment in the hair follicle. Those customers should know that, because if they have the wrong laser working on them, they might have thought that laser doesn't work on them.
Okay.
When in fact somebody used a laser that just was the wrong wavelength.
So you have 2 different wavelengths. Are there a wide variety are there more wavelengths than that?
Just 2.
Okay.
IPL is also used for laser for hair removal, but it really isn't a laser. It's intense pulse light, and what it does is it heats up everything, as opposed to a laser that just heats up the target. But typically a person comes into my office, and I'll assess what area. Say it's underarms. I'll shave the underarms. There's no waxing or plucking or tweezing prior to the laser.
But doesn't that sound like fun?
I know. Well, it's so that the target isn't gone, because if you wax, then there's no more targets left in the skin.
So you're leaving the stubble?
Right.
Okay.
Right. And then I just quickly laser over the area and then apply ice. And that's it. The area's a little bit red, can be a little bit bumpy, like mosquito bitey looking. That's
tender?
Follicular edema. Not really. It might feel like a sunburn.
Okay.
And it doesn't last very long at all.
Okay. So you've lasered someone's underarm. How long does that last for? Is it permanent? I mean, give me an idea.
One treatment will destroy 15 to 20% of the hair, because the hair has to be in the growth stage. So they'll come back in 5 to 6 weeks, which is the normal hair growth on the underarms, and then they'll get re-lasered. So by the end of 4 to 5 treatments, there's hardly anything left at all.
So it's just gone.
Yes, permanently gone.
Like they don't have to shave their underarms again.
That's right.
That's pretty cool.
Yeah.
So
Saves a lot of time in the morning.
I would imagine so.
Yep.
So is the same to be said for wrinkles or alterations in skin pigment?
Yes. The skin tightening, after you do a series and your skin's tightened, you probably want to come back like every 4 to 6 months just to stimulate the collagen again, because we continue to age.
Well, yeah. So you can't fix that with laser?
Aging process?
Yeah.
No. It's
not yet?
Yeah.
All right. Would you let me know?
I know. I know. The other thing I should mention too, it doesn't work on blonde hair or gray hair. So I would love to invent a laser that worked on blonde hair, because I have to turn down so many people that want hair removal and it's blonde.
Well, if you have blonde hair, it shouldn't be that big a deal to begin with.
It bothers people though.
Really?
It's amazing. Yeah.
Wow, blonde hair? All right.
Yeah.
I guess, to each their own. So it really doesn't hurt. It feels like a little snapping. Mm-hmm. And then afterwards, maybe it'll feel like a little bit of sunburn.
Right.
So really, there's not much to it. Sounds like it's way less painless than, say, a tattoo.
Oh, yes.
And there's certainly plenty of people walking around with those things, which I just don't get. So based upon the different issue, different number of treatments?
Yes.
Okay.
Somebody, for instance, with a lot of broken capillaries, they might need 1 to 3 treatments. And also with hair removal, you might find somebody that just because of hormonal problems, they'll need the 6 treatments instead of being done at 4 or 5.
Okay. And when you're saying broken capillaries, how does that appear on the skin? Just the red lines?
Yeah. For the laser that I have, it would have to be very discernible capillaries that you could see. If you have a diffuse redness, then you need what they call a Q-switch, a V-beam type of laser. It's a shorter wavelength, and it does the diffuse redness. And I can refer you to where you would go for that. So there's very specific lasers for specific problems.
I'm going to throw something else at you just because I'm learning.
Yeah.
How about birthmarks? Is that a different kind of a laser?
You would use the V-beam for that as well.
Okay.
Yeah. It's all vascular, and it's a multiple treatments, but the insurance should pay for that because it's a congenital.
Okay.
Everything else is pretty much cosmetic.
Okay.
They consider. And
so pretty much most of what you do is considered cosmetic, and
Yes.
it would be out of pocket.
yes.
Okay. But it's amazing what I find that people will still spend money to make sure they look good. Even if they're not healthy on the inside, they'll still spend to get their hair done, get their nails done, belong to a gym. Well, that's for inside and outside.
Right.
But it's amazing how many people will continue to do that. So I would imagine that laser is getting to be bigger as time has gone on.
It has. It's been popular for 30 years, but extremely popular in the past 5 years. And it seems like everybody has a laser. It's whether or not they know how to use it, and they're using the right laser for the right person.
Got it.
You'd never use IPL on someone with my skin type. It just wouldn't work. You wouldn't want to use a gentle laser, which is a 755 on a tattoo removal. You'd want to use a Q-switch.
Okay.
So you have to know what you're doing.
So can you do tattoo removal?
I can. I don't have the laser for that. That's one laser that I was renting.
Okay.
But it's very specific. And each wavelength will take out a different color. So even with the Q-switch, you have to make sure that the Q-switch will take out black, red, yellow. Everyone does these multicolored
Well, yeah.
or mixed colors together. It complicates things. The easiest tattoo to get out is Indian ink and the amateurs, because they don't put as much ink into the skin.
Okay.
A professional tattoo is usually meant to stay forever, so they put a lot of ink in your skin.
So I hope these people that are getting these tattoos are loving it. Otherwise,
Be very careful. They come into the office crying because it costs so much to take the tattoo off.
I would
and
imagine
it didn't cost very much to put it on.
I would imagine it costs way more to take it off.
It's about, for a credit card size tattoo, between $200 and $250 per treatment, and it can take 8 to 12 treatments.
So, God, I hope these people like their tattoos.
Yep.
Wow.
I hope I discouraged a few people from getting
I
them.
hope so too. I don't quite understand it. So, all right, so now that I don't have my beard, let me ask you about beards. Can you do the same thing for beards that you do with underarms?
Yes, especially like black men have curly hair, so they'll get ingrowns in their face.
Right.
And the gentle yag, which is the longer wavelength, does a wonderful job getting rid of that condition altogether. And if you don't have ingrowns, if you just want to shave less around the neck, just a couple of treatments will diminish like 30 to 40% of your hair, and it just will be less tiresome, especially if you have a protruding Adam's apple and you don't want to shave around that. You can get rid of all the hair in that area too. A lot of men don't think of laser hair removal on their face, but the men that I have treated have been so happy to be able to shave less in certain areas.
Or will men come in and do it to take care of everything?
I have male clients for skin tightening as well. And some men do want the hair off their face, only if they have a problem though. I haven't had too many that
are just doing it for
just
cosmetic?
want it to look like a baby face, yeah.
Because I got to tell you, when I had my beard, it was so easy in the morning. And now,
to shave.
Shaving, it just takes too much darn time. But I guess I'm going to suffer with that for a little while.
Yeah, I think so.
So, you shared the cost of tattoos. Do you feel comfortable in sharing the cost of others, or
yeah,
is that okay?
Yep.
All right.
For the most part, you'll find specials out there.
Okay.
A lot of specials for like lip and chin have been running about $100 per treatment. And you can count on 6 treatments for the face.
Okay.
Very seldom are you done earlier than that. Underarms, I've seen anywhere between $129, which is the price I'm offering right now, to $175 per treatment.
Okay.
And so I've seen some people done at 4.
Okay.
Bikinis, the same thing. It can run between $129 and $250, depending on how much. Everyone's bikini is a little bit different.
Okay.
And the most expensive would probably be the men's chests, the men's backs, and the ladies' legs. And that could range anywhere between $400 and $600 per treatment.
Per treatment. And again, multiple treatments.
Multiple treatments.
I'm interested in the skin tightening. What can I expect for that?
You need to numb for it because it is uncomfortable even with the numbing cream. You feel it because we're trying to produce thermal injury. So once we produce that thermal injury, the collagen gets released, and then you'll see the tightening. The procedure takes about 20 minutes. I go over the whole face, kind of like making little Olympic rings, and as the skin feels hot, then I can move on to the next area of skin. And you leave hot. It looks like you just got off the treadmill. Your face is a little flushed. You can put makeup on right after.
Okay.
And you can, just continue your day. I've seen people go back to work.
Really? Okay. But are they uncomfortable afterwards?
No, you only feel the laser just during the actual pulse itself.
Okay.
It's not a lingering kind of pain like a bee sting.
Okay.
It's, they keep coming back, so it can't be too bad.
I would imagine.
And everyone knows they have to suffer to be beautiful.
So what can sunspots. We haven't talked about that. What can you expect before, during, after, as far as that's concerned?
It's usually 1 pulse per sunspot. And what I do is I turn off the cooling part of the laser, the DCD part, which is a cryogen spray in my laser. and just pulse the skin. The area gets darker, and then over the next 3 days it dries up, and the skin underneath heals, and then the dead skin will fall off, and the natural skin color will be back without the sunspot.
So what technically is a sunspot? Excuse my ignorance. I really don't even know.
It's just a bunch of melanin sites. It's the cells in our skin that give us color that just all kind of group together. And a lot of times it's, your driving side of your face that constantly gets your sun, a cheekbone.
Okay.
And it's easily fixed. And then you should be wearing sunblock to prevent new ones. And you always wear sunblock after laser treatments because you're more prone to the sun after that. And you want to prevent complications like hyperpigmentation. Okay.
Talking about sunspots, I don't even know if it's I don't know if there's a technical name for liver spots.
It's basically the same
thing. It is basically the same
age spot, sunspot.
Okay. And the same can be said for those as with the sunspots as far as treatment?
Yes. I've done women's hands because people look to see how old you are by your hands too.
Absolutely. And I would imagine with the hands it would not just be the spots, but also the skin tightening as well. Do you do that as well?
No one's asked me to do that. People will ask me to do a microdermabrasion on their hands, but no one has asked for the skin tightening on their hands. Interesting, though.
It seems like it would be something that probably women would want.
I'm going to look into that, Dr. Sandy.
And that,
yeah.
I mean, because that's, hands.
Do you want to be my guinea pig?
Sure. How bad do they look?
They actually look good, so.
So you just talked about microdermabrasion.
Yes.
So that's not laser.
It's non-laser.
So there's some other things that you do at your facility that's not just laser.
Yes.
Talk to me.
Two things, the microdermabrasion and trichloroacetic acid peels, which is a medical grade peel.
Okay.
15 to 20% acid is applied to the face. And I'm looking for like a snowy kind of skin, which means I've destroyed the first layer of skin.
Okay.
And then that layer will eventually dry up and peel off and leave you with smoother skin underneath. That procedure is pretty beneficial. They say it takes care of precancerous lesions.
Really?
Yeah. And it also tightens the skin and stimulates collagen. The microdermabrasion will be a gentle exfoliation with an aluminum oxide crystal.
Okay.
And it's hooked up to a vacuum, so it will suck up into the machine your dead skin cells along with the dirty crystals. And it gives you quite a glow. You'll see a difference from just one treatment.
Is that something similar to getting a facial?
Very similar.
Okay.
Very similar. I don't recommend it if you have capillary problems because you wouldn't want to do anything to your face that's rough like that. But especially with a series of treatments, you can get rid of or make less scarring, some maybe chicken pox marks, things like that.
Interesting.
Yeah.
So you really offer a lot of different things to look to look younger.
Yes.
And really there is health benefit because you were saying that some of those things can really take care of the precancerous lesions.
Yes.
So it's not just about looking better, although that does help.
It does. Yeah. I think too, when you feel confident, you're going to go exercise more, you're going to go out more, you're going to want to socialize more. You know, I know so many people that become couch potatoes because they're unhappy with the way they look. You know, go out to the gym and exercise and drink the water and do all the things you can do, and then, you know, then you can feel like you can splurge on these procedures and look better permanently.
So I have to ask you, I know for me, there are always some patients who stand out that I know that I've made a tremendous difference in their lives, and I have stories. Is there anyone that has really kind of done it for you? Is there anyone that kind of pops into your head?
Yeah, there's a couple people like that. I've gotten some thank you notes, and I think they would want to remain anonymous.
Well, I'm not, yeah. So just tell me a story. Don't Joe or Jill. Just, can you share a story?
Yep. Well, Jill came in for skin tightening, and she was going through a divorce and feeling really bad about, you know, her life in general. And I think that's why she originally wanted to come in and have the skin tightening. And she was one of those people that wasn't 75 when she started. She was more like 50, and had a tremendous before and after picture. And she just, you know, it just helped her get through her divorce. And you know, you see them every month, so you develop a bond with these people. And she was just very appreciative, and I was, you know, I love talking to people. So
feels good when you do something, when you can really help change someone's life.
yeah, absolutely.
Well, that's pretty good. So we don't have much time left, and what I would love for you to do is talk to my audience for any last words that you want to give them, anything you want to share, because we're about to wrap up, and I really want to make sure that you tell them everything you want to tell them.
Okay. I guess what's important to know is that lasers are safe in the hands of the right practitioner, and also the type of laser that you choose to have really should be right for your skin. And make sure that whoever's going to be lasering you has that right laser for you, or you'll be pretty much wasting your money. And if you have any questions, you can go to my website, and I have a lot of explanations on the different lasers. It's www.laserenhancedtherapies.com.
Perfect. And you're in Tewksbury, and I can vouch for you.
Thank you.
I can vouch for you. And this is something very different. I've never had anyone like this on my show, and I think I think that it was I think, if I do say so myself, I made a great choice in getting you on my show.
Thank you. I appreciate that.
So hopefully this opens your eyes now to a different form of laser than some of the laser stories I may have told you with some of the healing laser that I use. So now we have a different form of laser. Hopefully you learned something. Hopefully, you know, as 2009 continues to roll on and you become healthier and healthier, then you'll do other things for yourself in that vein. So what I'm going to recommend to you is that you continue to take care of yourself both inside and out. And I hope that 2009 continues to be the best year you've ever had. And I did my best to showing my green for St. Paddy's Day, so this is going to show all month. I wish all of you a happy St. Paddy's Day, a wonderful spring season, and I'm looking forward to seeing you again next month. Have a great month.